Well, during this pandemic, we have been inviting doctors to join us to answer your questions about COVID. And this afternoon, we are joined by Dr. Bruce Farber. He is the Chief Public Health and Epidemiology Officer at Northwell Health. Good afternoon, Doctor. Thanks so much for joining us.
Good night. Good afternoon. Thanks for having me.
Before we get to our viewer questions, there was a lot of talk today about the CDC, from the CDC and the White House about well-fitting, high-quality masks and the importance of them. So while we are in this latest surge, it kind of feels like we need a little bit of a refresher about masks. So what would be considered a high-quality mask and what makes it fit well around your face?
So the highest quality mask, which is the gold standard, are called N95s. Those are worn by healthcare workers when they're taking care of COVID patients. They are tight-fitting, they need to be fit tested, and quite frankly, they're not that comfortable. I've worn many of them over many years, and you have a hard time wearing them all day. They are difficult because they're so tight-fitting.
But is that what people should be wearing?
Well, I think people who are actively around COVID patients, I'm not sure it's practical for the general public based on their expense, their availability, and how difficult it is to wear them all day long, that's a great remedy. I think a K95 is the next best compromise, which is a tight-fitting but somewhat looser mask. And then, of course, the surgical masks, which are less effective but are much more comfortable. The ones that I think you need to avoid are loose-fitting cloth masks. They're really not of any value. And any mask is better than no mask inside.
And to cover the nose, also very important. All right, Doctor, thank you. We want to get right to our viewer questions. And our first one comes from Jenny in New Jersey. And she says, I showed symptoms of COVID back on 12/28 and tested positive for COVID. I have taken 2 more PCR tests 2 weeks apart, and I'm still testing positive for coronavirus. How long will I have to wait for a negative test? I've had no symptoms for 10 days now.
The answer is stop getting tests. You're not contagious after 10 days unless you're immunosuppressed. The COVID test by PCR can remain positive for many months after you've recovered, and it's of no import. So the answer is stop looking for a negative test, get on with your life, you're no longer contagious.
And still wear that mask, correct?
In general, you wear a mask everywhere inside because unfortunately with Omicron, you can get reinfected frequently.
All right, Dr. Farber, thanks so much for chatting with us this afternoon. Very important. We're going to have another doctor join us to answer your questions coming up at 5:30. You can submit your questions at ABC7NY or on our free news app.